We are at the downtown campus for Orlando Health, and we are honored to be joined by Dr. Arnaldo Velez today, who is a vascular neurologist here. Welcome, Dr. Velez. Thanks so much for being here.
Thank you for having me.
A lot of your patients are coming through the ER, and they don't know what's going on. And while we've heard a lot about the signs and symptoms of stroke in the last few years, they're different in every single person. What should we really be looking for?
Yeah, so we have an acronym for that. It's called BFAST. B stands for balance or incoordination. E is for eyes, so visual loss or double vision. F stands for face, asymmetry of the face or facial drooping. A, it's arm weakness or legs. S would be speech, so inability to speak or slurred speech. T is for time, which is the most important aspect of stroke care, because about 2 million brain cells will die every minute in patients that are having a stroke.
What kind of time are we talking about? Minutes, obviously, but do we have hours? I mean, if we're not near a hospital, do we have days?
The sooner the better. We do have a medication, the clot-busting medication that we give stroke patients, but we have a time window for that medication, and it's 4.5 hours from the symptom of the symptom onset. We also have the capability to go in with a catheter to the brain and get the clot out. And that has a time window of about 24 hours.
The symptoms that we talked about in BFAST, I mean, those are kind of easy to see. But other people experience symptoms that we don't think about when we're thinking about stroke. What are some of the additional symptoms that people can have?
The most common symptom that we see, it's dizziness that comes out of nowhere and it stays. The other thing is the worst headache of their lives. Also seizures in older population out of nowhere as well.
What are some of the most important things we can do to reduce our stroke risk?
Yeah, most importantly, you have to know your risks, right? Do you have high blood pressure? Do you have high cholesterol? Do you have diabetes? And if so, make sure that you control those risk factors. Also, limit alcohol intake, as well as avoid smoking. Exercise at least 20 minutes per day, and then a healthy diet, high in whole foods, low in fats, and things like that.
What kind of outcomes are you seeing now versus even a few years ago?
We're seeing many more patients going home rather than going to a nursing home or a rehab facility.
In so many cases, they can go back to having a perfectly normal life.
Completely normal lives, yeah.
Yeah, okay. For more information, visit orlandohealth.com/stroke.